I would like to welcome you to tonight's virtual program, Mastering PicoWay, Real-World Strategies for Pigmentation, Rejuvenation, and Tattoo Removal with Dr. Douglas Wu, Dr. Cordula Ahnhudt-Franke, and Dr. Branislav Lukic. If you have questions during today's event, please enter them in the Q&A box. We will answer them at the end of the webinar. If you encounter any issues with the video or connection, please refresh your browser, as that will often fix minor issues. Google Chrome is the preferred browser. The information and photographs contained in this presentation are the property of Candela and its consulting healthcare providers, and are provided for global training, educational, and discussion purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local laws, or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. By sharing this information, neither Candela nor any of its consulting physicians give you the right to use the information presented, and this content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professionals. Individual healing times, discomfort, treatment results, and satisfaction can vary. By participating in this webinar, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the webinar. With that, I am very pleased to introduce our moderator for this event, Dr. Douglas Wu. Dr. Wu is a double board certified dermatologist in Canada and the USA with specialized training in cosmetic surgery through the American Society of Dermatologic Surgery Fellowship. Renowned for his contributions to aesthetic medicine, he advances laser rejuvenation, tattoo removal, injectables, and non-invasive body sculpting. As Director of Research, he supervises clinical trials driving innovation in cosmetic dermatology. Dr. Wu, the floor is yours.
Thank you very much, Aviva, for the kind introduction. And before I begin, I'd like to introduce my esteemed colleagues joining us on this panel, Dr. Cordula Ahnhudt-Franke and Dr. Branislav Lukic. Very honored to be presenting alongside them today. Dr. Cordula Ahnhudt-Franke specializes in aesthetic dermatology and laser medicine. She leads my skin practice in Mallorca, Spain, and is an active member of leading medical and aesthetic societies in Europe and the USA, including the American Academy of Aesthetic Medicine and the European Society for Lasers and Energy-Based Devices. Dr. Branislav Lukic is a certified aesthetic medicine doctor and ophthalmologist specializing in oculoplasty. Dr. Lukic is the VP of SES-IAM Association and currently practices in Miran Clinic in Belgrade, where he combines lasers, injectables, and surgery to achieve optimal patient outcomes. So very, very happy to be on the webinar today with my esteemed colleagues. So without further ado, let's kind of jump right into it. I'm going to start, and then Dr. Ahnhudt-Franke is going to follow me, and then Dr. Lukic is going to complete this session. But at any time, if you have a question about any slide or whatnot, then please just enter it directly into the Q&A box, and we'll get to all of the questions at the end of all the presentations. Okay, so this first session is going to be essentially just to introduce the PicoWay platform system and kind of give an overview of its capabilities. So the PicoWay system is a true picosecond laser pulsed with 4 distinct wavelengths, each of which are quite useful. And it is used on label for benign pigmented lesions, acne scars, wrinkles, and tattoo removal. The key here is that all 4 of these wavelengths are true picosecond pulsed. And they're not only picosecond pulse, but they're ultra short picosecond pulses, all of which fall under the 500 picosecond pulse duration range. The range of handpieces available for this device and this platform include full beam handpieces, including the Zoom handpiece, the 785 nanometer handpiece, and the 730 nanometer handpiece, as well as split beam handpieces, which are the Resolve 532 nanometer handpiece, the Resolve 1064 handpiece, and the split beam with diffuse rings, so-called Resolve Fusion 532 nanometer handpiece. And all of these have excellent use cases, and we'll be explaining each of these capabilities shortly. When we think about picosecond or short pulse laser, and we're considering what to get or what technology or what device to use, one of the, in my opinion, foremost considerations is, in fact, the pulse duration. Because the reason we get short pulse lasers is because we want that very short pulse and all of the advantages that come thereof. And the PicoWay system, since its introduction, and way back in 2014, 2015 or so, has remained one of the shortest picosecond pulsed laser systems currently available. And that includes all 4 of its wavelengths. As you can see, at 1064 nanometers at 450 picoseconds, that's the longest pulse duration on this system. It goes all the way down to 250 picoseconds at 730 nanometer wavelength. And so this, I think, is extremely valuable because almost all of the advantages and effects of this laser system rely on this ultra short pulse. So let's talk a little bit about benign pigmentation, which is a very common use case for this laser system. And I want to start first by building a little bit of groundwork in terms of the science behind why we use these technologies. And it begins with the so-called theory of selective photothermolysis. This was published by Anderson and Parrish in 1983 in the journal Science. And essentially, it described a method by which we can use lasers to perform cutaneous microsurgery by targeting chromophores in a selective way. And so I'll illustrate here. The chromophore, in this case, let's just say it's melanin, and we select a wavelength of laser that is specific to the target chromophore, so a wavelength that is absorbed specifically by this chromophore. We deliver enough energy or fluence into the chromophore to affect some form of change, whether it be thermal change with classic selective photothermolysis or an acoustic change, a mechanical change with selective photoacoustolysis. And then the key for this theory was the confinement of that energy to the chromophore, so it only affects the target and doesn't damage surrounding tissue. The way to do that was to make sure that the pulse duration was less than or equal to the thermal relaxation time of the target chromophore. And that way we could kind of confine the energy to the target. And this is where pulse duration becomes extremely important, because when we use a short pulse laser to treat benign pigment, we can immediately see a very selective tissue response that guides our treatment. And this was published by Molly Wanner and colleagues in the Journal of the American Academy back in 2014. But it's worth a peek if you haven't seen it yet, because it describes these laser endpoints, and they still to this day guide most of our treatments when we talk about benign pigment. And the key here is that for benign pigmented lesions, the optimal therapeutic endpoint is immediate whitening that is confined to the pigmented lesion. So there's 2 parts to this. There's the color change, which is whitening, but there's also the selectivity. It has to be confined to the pigmented lesion. What that means, I'll illustrate here. So let's just say we have a benign pigmented lesion and we use the laser to treat it. Usually, eventually, the laser is going to hit the edge of the lesion, and so there's going to be some non-lesional skin as well as lesional skin that is captured. An optimal endpoint is if the lesion whitens, but the surrounding skin remains unchanged, at least to the eye. The suboptimal endpoint would be if you just get a white sort of spot and everything whitens, okay? And that would be a non-selective endpoint. If we achieve that, then we're probably going to get resolution of the benign pigmented lesion, but we'll also increase our chance of side effects in terms of hyperpigmentation and or other side effects that are not desired. And so the selectivity is actually the most important part about this. And the shorter the pulse duration of the laser, the easier it is to achieve fine selectivity at lower energies. And this is one of the major advantages of using an ultra short pulse laser like the PicoWay system. And so this is a homebrew experiment that I did, and it kind of just illustrates what I mean. When we take even a short pulse laser, like a 2 nanosecond or 8 nanosecond, this is, top of the line nanosecond pulse lasers, and we use a variety of different fluences, all the way down to 1 joule, for example, we still get a non-selective whitening. And not only that, the photomechanical effect is so great that the epidermis itself gets tattered and destroyed at any fluence, no matter what fluence we use at these pulse durations, because they're too long. When we get down to the shorter pulse durations, 800 and 600 picoseconds, we can begin to see a little bit of selectivity at the 600 picosecond and extremely low fluences, but still, we're essentially seeing a circular white spot with very little selectivity. It's only when we get down to 375 picoseconds, which is the pulse duration of the 532 nanometer wavelength on the PicoWay system, that we start to see a very, very good gradient of selectivity. As you can see here at 0.4 joules per second, we get basically a mild pigment darkening. At 0.5, we start to see a little bit of cavitation and frost. At 0.6, it becomes more pronounced. And at 0.7, in this particular case, we get perfect selectivity. We get whitening of the lesion, but sparing of non-lesional skin. And you can see that in the central portion of this spot. By the time we hit 0.8 and 0.9 and 1.0, we start to lose selectivity because the fluence overcomes the selectivity, and we get non-selective whitening. And so in this way, we can finally adjust our settings at truly only at ultra short pulse durations, because we lose that ability if the pulse is any longer than roughly 500 picoseconds or so. And this is what we mean by therapeutic endpoint selectivity. It's extremely important. So when we treat epidermal pigment, we often encounter a case like this: skin type 3-4, and pinpoint little pigmented lesions. They're usually 1 millimeter in size, maybe even less than that. And the smallest spot that we have to treat them is 2 millimeters in size. And so we, by definition, must treat non-lesional skin. And in order to treat it safely, we have to find a way to selectively target this 1 millimeter spot and spare the surrounding skin. And it so happens that with the PicoWay and all of the pulse durations and the adjustments that can be done with the system, this is something that can be easily achieved in almost every single situation. Here's a more classic case of benign lentigo on an Asian fellow here. And a couple treatments later, it's mostly gone. And similarly, even with slightly raised lesions, more along the lines of seborrheic keratoses, also we get reasonable resolution after a small number of treatments. So as long as we can achieve that selectivity and the cavitation or whitening phenomenon, then we can be relatively assured that we're going to achieve the safest and the most effective level of treatment that we can. Now, in terms of dermal pigment, the PicoWay system is extremely good at treating dermal pigmentation. For example, this young lady came to me from the Philippines because she had nevus of Ota and had undergone multiple treatments. It was somewhere in the order of 10 treatments or something of that nature with a nanosecond pulsed laser. And the last 5 or 6 of those treatments had not really provided her much in terms of improvement. However, with the 730 nanometer handpiece at 250 picosecond pulse duration, we can see that even after 4 treatments, there's some reasonable clearance of her lesion. And we did publish this case, I think, in LSM back in 2019. But she did get a little bit further resolution after this as well. This Thai woman lived all her life with this nevus of Ota, never really liked it, but never really had an option to remove it until she reached her adult years. And so again, with the 730 nanometer handpiece, we're able to selectively target this dermal pigmentation and remove it in a reasonable amount of time. For this Korean woman, she had these bilateral nevus of Ota-like macules, so-called abnoms, to her cheeks. And this is also a form of dermal melanocytosis. And again, with the 730 nanometer handpiece, we can treat it with relative ease and relative safety. For this young man, he wanted to sort of lighten up his benign nevi. And so with a variety of different combinations of the PicoWay laser system, we were able to address his concerns to a reasonable degree of satisfaction. Now, the PicoWay platform, the power of it is because it's so versatile. It can treat benign pigments, like I just showed, and our speakers subsequent to me will go into depth in acne scars and tattoo removal. But in fact, if we leverage the entire capabilities of the system, we can actually achieve a complete rejuvenation in terms of pigmentation, wrinkles, and other sorts of indications that commonly present to our practices. And this relies essentially on the split beam technology. Okay, and the basis of the technology was demonstrated in this paper here by Habima and colleagues back in 2012 in the Journal of Biophotonics, which essentially illustrated the mechanism of action that we call thermionic laser-induced breakdown. And this is critical to understand in order to leverage the pan pieces that have split beam technology for the PicoWay. And I'll illustrate it here again. So once again, this relies on a chromophore. It's a chromophore-assisted process. Okay, without chromophore, it doesn't work. So it has to be chromophore-assisted and it has to be selective. But if we take a laser, okay, that is small enough of beam diameter and high enough peak power, essentially the power density, otherwise known as irradiance, if that irradiance is high enough and we target a chromophore selectively, then we can achieve a level of heat that exceeds the ionization threshold of the chromophore, thus resulting in so-called seed electrons or free electrons, essentially being ejected from nuclear orbit. These seed electrons, they are extremely optically absorptive. So they continue to absorb the laser pulse during this, whatever, 250 to 500 picosecond pulse duration, and they absorb that energy, becoming high energy free electrons. And because they're free, they can move in space and collide with neighboring atoms and molecules, thus transferring their energy. And if enough energy is transferred, then another ionization threshold can be crossed and another free electron can be generated. So when we first had one electron, we now have two. Alternatively, it can recombine with its original ion, for example, and that deceleration in space will essentially emit a broadband photon. So visible light, something that we call plasmoluminescence. And this can be visualized and it's also clinically useful. But going back to the two free electrons we now have, the laser is still firing, and so they're still absorbing this energy, and they also can become high energy, and they also can cause ionization of neighboring molecules in a process that we call cascade ionization. It all happens almost instantaneously. Okay, 1 becomes 2, becomes 4, becomes 8, 32, etc. And before we know it, we have what we call plasma. Okay, and this focal generation of plasma, which is essentially a superheated ionized gas, it's extremely absorbent of laser energy, and it absorbs that laser energy, becomes very hot, and but because it's a gas, it immediately transforms that thermal energy into a mechanical force that leads to its expansion. And the expansion of plasma is extremely fast. It can reach speeds in excess of the speed of sound, thus creating a so-called shock wave. And the shock wave is the first mechanical damage or photoacoustic damage that we can get into tissue. The other thing is that it's very hot, thousands of Kelvin. So it immediately creates this cavitation phenomenon that forms steam bubbles. It vaporizes the tissue, and these steam bubbles form that are also very hot, they're gaseous, and so they also expand, and the expansion of the bubble wall in tissue causes the second form of mechanical damage that is generated by this mechanism. So ultimately, we have a wavelength of light that absorbed selectively by the chromophore. We have focal plasma that is created, okay, because of the conversion of thermal energy into a mechanical force. Target damage ensues, and this triggers a biological response. And it's also accompanied by an auditory and a visible signal, both of which we can use clinically immediately to guide our treatment. This process, called thermionic laser-induced breakdown, there are other names for it: laser-induced optical breakdown, chromophore-assisted induced breakdown, etc. This is a critical mechanism that can only be achieved with a sufficiently high irradiance, which means that your pulse duration has to be very short, your beam diameter has to be very small, and your peak power has to be very high. And those three items are very difficult to get into a single platform, but the PicoWay does it brilliantly. And so what happens? Histologically, we get these characteristic little vacuolizations in the epidermis and papillary dermis, and eventually these resolve into collagenesis and elastinogenesis. But the plasmoluminescence we can see is titrated based on skin type. The more chromophore density there is in the skin, the lower energy threshold is required to achieve this plasma formation and therefore luminescence. And again, we can use this to guide our clinical treatments. So the endpoints, although there is the whitening, selective whitening, that was described in 2014 and we've known for decades in clinical practice, there's also the plasmoluminescence, which is a specific endpoint that we can see with this mechanism. There's the audible sound, that's the plasma expansion and the shock wave. And then there's a palpable impulse that we can even feel. If we're treating, say, tattoos and we put our hand close to the tattoo area, we can feel a dull thud that is the shockwave from the laser mechanism. And the after effects have been well published. We know that there's tissue remodeling afterwards with new collagen fibers, new elastic fibers, and that stuff is what eventually results in improvements in skin quality, acne scar revision, and all of the effects that we associate with so-called rejuvenation. So these handpieces are extremely valuable. The Resolve 532 handpiece and the Resolve 1064 nanometer handpieces, they are engineered to a very high degree. They use a holographic beam splitter, which is unique in this split beam category because it perfectly splits the beam into 101 microbeams, each with a very identical diameter and beam profile. And so that gives you the consistency of treatment from pulse to pulse. So for example, when we use the PicoWay Resolve handpieces, we can get a perfectly split beam pattern. However, with other sort of split beam technologies, we get a less perfect pattern that develops, okay? That being said, with these so-called less perfect, they do cover a greater percentage of skin per pulse, and so that can actually be a good thing, which is why Candela has developed this so-called 532 nanometer Resolve Fusion handpiece, which combines the perfect engineering of the split beam, the holographic beam splitter, with a diffuse ring of lower fluence energy surrounding each of these columns, therefore allowing us to get a reasonably high beam energy, but a much higher treatment density per pulse. Okay, and this can be a very useful thing when leveraged in clinical situations. So there's kind of a handpiece that covers almost all situations that are reasonably required for day-to-day practice and improving patients' aesthetic outcomes. So this is a case here that's pretty common. I think walk into our clinic, individual skin type 3 to 4. This was a Chinese woman. She had problems with her pigmentation, discrete benign pigmented lesions, but also with the general quality of her skin in terms of pore size and texture and just overall dullness to her skin. So she wanted to find improvements in all of these areas. And with the PicoWay laser platform, we can kind of address almost all of these issues with a single platform and single treatment. Then the strategy here would be to essentially target each of the discrete pigmentations that we see using the theories of selective photothermolysis and photoacrystallase, so we get that selective endpoint. And then we can change our spot sizes and recalibrate the device almost instantly. It takes seconds to do so, which is another major feature that helps clinically. And we can target even the smallest ones, the 2 millimeter, 1 millimeter spots. We can just go about doing as much detailed work as we want. And then finally, we can switch to a split beam handpiece and cover the entire surface, thus blending away any residual pigmentations, but also stimulating that collagen and that elastin that we need to improve overall skin quality. And within a small number of treatments, this individual happened to take one, but sometimes it's 1 to 3, whatever is the case, we can get a nicer sort of improvement in the skin that patients really appreciate. It's this softer, natural sort of glow that they can kind of go about their day without makeup, or if they wanted to wear makeup, they could, but essentially it's a very natural sort of look that tends to be very pleasing for many patients. And this can be applied to any skin type. Skin type 1, this treatment here, and skin type 2, we combine the Zoom and the Fusion handpieces in order to achieve this result. For this Vietnamese woman, also very similar to the first case that I showed, very similar strategy. This one took 2 treatments, but the Zoom and the 1064 Resolve handpieces were used in combination to give her a bit more of a glow and improvements in skin quality. And for this Chinese woman, she had a little bit of a more complicated picture with some background dermal, hormonally driven types of pigmentations superimposed upon which were the benign pigmented lesions, but still following the same principles as I've illustrated scientifically, we can approach this methodically and get reasonably good results within a couple treatments at most. And finally, the PicoWay system continues to innovate and improve, and the latest innovation is this engineered arm. It's a better arm than it used to be shipped with the system. It's much more stable. It has a little bit of a greater reach. Okay, so it's a little bit longer, and the joint stability means that the mirrors are much better aligned, and they stay aligned and they stay effective without damage over and over and over again. So your cost of maintenance goes way down. And so I've been actually very, very happy with this arm. It's a major improvement, even though it's an unsung improvement, but it's been a huge, huge deal. So in summary, I think the PicoWay laser platform is a very versatile platform. It can handle many different indications. It has 4 true picosecond pulsed wavelengths that each have their use types, and it can be used across a broad range of Fitzpatrick skin types. Thank you very much. We'll hand over the floor now to Dr. Ahnhudt-Franke.
Thank you so much, Douglas. So greetings from Mallorca, from sunny Spain. And I'd like to introduce to you the PicoWay Resolve 1064 handpiece, which has become a real great tool that we are using a lot in our patients. Today, our patients have changed a lot. I mean, they desire for no downtimes, they want natural results, they want a good skin quality, but they don't like any side effects. So we have to address our treatments in a multi-layered technology and a multi-layer approach, right? And explain to our patients that it's serial treatments. And for this approach, in my opinion, the PicoWay Resolve 1064 is a really, really useful handpiece. And I'm going to show you how we use them in our clinic. So we heard already a lot of great technical details from Dr. Wu. So thank you so much for that. There's not much to add, actually. So as we already heard, it's a split beam picosecond laser with the wavelengths of 1064. It has a CA mark for the treatment of acne scars, wrinkles, and benign pigmented lesions. And it's a purely photoacoustic impulse, which with no ablation and no coagulation. And this has a really, really great effect for our treatments. So we have a very low risk of thermal injury. We have not much heat that we are creating by this photoacoustic impulse. It's so fast, it's extremely fast that we kind of smash the glass with the hammer instead of heating up the tissue, which allows us to use a complete different type of stress moment. So it's rather mechanical than a thermal stress. And with this special technology, we can use that for even darker skin types, up to skin type 4. We can use that also for people that are tanned. So it allows us to treat our patients in the summer months, even if they do have a bit of tan, so we are still safe. And also it allows us to treat with very low discomfort. We do not use anesthesia usually, and we don't have to fear the risk of hyperpigmentation. So as Dr. Wu already explained very well to us, we have in PicoWay Resolve, we have a uniform beam delivery. So we have what we call the top hand profile, which means the energy is delivered in the whole area, not only in the center, so which allows us to have no energy loss and to treat the full area with the same energy. And as we already heard, also the mechanism of action is on these so-called LIOPs, these laser-induced optical breakdowns in the dermis. So we basically leave the epidermis intact, so you have actually no damage on the epidermis, but rather those breakdowns in the dermis, which form those micro cavities, and they trigger quite a complicated biological wound healing cascade, which then leads to the stimulation of collagen and elastin production, and finally to the improvement of the dermis. So we talk today a lot about skin rejuvenation. What does that usually mean? I mean, as we all know, the skin, not only the skin is changing when we age, but it goes through all the layers coming from epidermis, dermis, but also subcutaneous and the layers even below. So the idea is always, you know, we always explain to our patients the model of this table. Yeah, so we need a good stable table with good a stable construct, and then the surface as well has to be nice. You know, this is what makes the whole system attractive. So the Resolve 1064 Resolve allows us a really minimal social and downtime, no injuries on the top, and it's really ideal for multi-layer protocol. So we usually start with 3 initial sessions, 4 weeks apart, and then we do maintenance treatments every 6 months. And we combine it very often with other injectables like polynucleotides, other collagen stimulators, and so this becomes a whole concept. So these are my full phase treatment settings that we usually use as a standard. We can adjust them in some cases, so we sometimes go higher, sometimes a bit lower, but usually we start with 2.1 millijoule and perform 3,000 to 800 to 4,000 shots on a full phase treatment. A very interesting indication for me are also the acne scars. We used to treat the acne scars before a lot with the 1550 non-ablative fractional laser and combined it with even with the 1940 of the Nordis platform. But then I started to use more often the Resolve 1064 handpiece because people are asking for less downtime, for less redness, and I'm quite amazed, you know, how the skin really improves with this modality as well. Yeah, so the good thing is we have minimal downtime as well. We can work on higher skin types up to Fitzpatrick 4. And again, we usually perform 3 to 6 sessions, depending on the depth of the scars, spaced 4 weeks apart. And as you probably also combine them, usually we perform combined treatments with Nordis platform. So we using the PR if patients have inflammation, and then combining them with the NFL 1550, and then maybe even with substitution fillers depending on the scar type. Yeah, so but the 1064 Resolve helps really to improve the texture and softens the scar edges and reduces the atrophic depth. So combining PicoWay Resolve and NFL 1550 has 2 complementary mechanisms. So as we heard already with the Resolve, we have the photoacoustic pulses, so the LIOPS and the dermis, which is the non-thermal effect, whereas with the 1550 we have a thermal coagulation, which leads to a deeper remodeling. So we use those synergistic results. Yeah, so we resolve, the Resolve improves the texture and the scar edges, whereas the 1550 helps us to reduce the scar depth and the fibrotic tissue. At the moment, I'm using the protocol 1550 directly on the scars, and then I go over it with the Resolve 1064 over the full affected area to improve texture, and that seems to work really, really well. And it's a very tolerable treatment for our patients. So when we use the 1064 Resolve, we do have a couple of tricks actually. So with the energy do not start too low. So we usually do not go lower than 1.9, rather 2.1 millijoule. And you really need to reach a certain amount of pulses. And then, of course, we adjust them by the response of the patient, ask them what plans they have tomorrow. But usually there's not much downtime involved, so patients can basically continue their normal life. It's very important to do continuous gliding movements without any pauses. So, and really have a full contact to the skin at all times. Yeah, this is very, very important to train the staff very well to perform this right. Overlap zones are advisable to do. We do avoid pre-treatment with hydrofacial or glacé on the same day, as we notice that the skin becomes less easy to glide, you know, so it's better to do those treatments earlier and not on the same day. We always, when we do full face treatments, we always include lower eyelids and upper orbital region, you know, to benefit or to achieve those benefits of collagen stimulation in that area, which is usually a very weak tissue and ages usually quite fast. Also be careful at the jawline, treat it fully and symmetrically, so do not stop over the jawline, yet then people are left, well, then we don't actually get this benefit of collagen stimulation in that area. And regarding anesthetic, we aim not to use any local anesthetic. We rather use the simmer air cooling, which the patient can hold by himself, so they have something to do. And this, I must say, is a really, really nice setup, which is not painful. I've done it myself many times, and it's really bearable. Yeah, the typical endpoint of this treatment is a mild erythema, usually not much pinpoint bleeding, so you can easily cover that afterwards with makeup. So I'm going to show you a short video here. Let me see where it is. Here it comes, so you can see my assistant performing the treatment. Is it running? No. Yes, no. Now it's running. Yeah, so you see how she's really gliding over the skin, not too fast and not too slow. It's very bearable, and changing the direction all the time. Yeah, so it's quite easy to do, and it's something that you can let do by your assistant. Okay, so then let's go to the next one, the aftercare. We usually apply immediately a calming mask. So phytocorrective, for instance, you know, from SkinCeuticals, feels very nice. Put it in the fridge, and that's a very comfortable feeling afterwards. Tell your patients to avoid rich or greasy topicals for the first 24 hours. Yeah, in some cases we see these acne-like breakouts, which always disappear. It's not a proper acne, it's not bacterial, but it might be aggravated by greasy products. So it's better to use just pure hydration or calming products. Of course, SPF 50 as well. And the retinol can be continued after about 2 days after their procedure. And a mild tan is no contraindication for the treatment. Yeah, so we treat all year round. As you know, we have lots of sun here, but this is no problem, and we've never seen any side effects with it. Yeah, so the big advantage of the 1064 Resolve handpiece is that it's a non-ablative collagen stimulation with low downtime. We have no tightening effect. Yeah, so it's more a firming effect. So if patients ask for tightening, we need to combine it with other modalities. But it's great for mild to moderate texture issues. We even advise younger patients to start with it to prevent and to keep up the collagen. And in our clinic, it's the part of a multi-layer approach, which works super well. And in terms of acne, we use it for of course, not for all scars. Yeah, it has less effect on hypertrophic scars or deep ice pick scars. They have to be addressed rather with the CO2 laser. There's lots of supporting literature which I can recommend to you. So it has been a proven technology for quite a while, and it has been published in many studies. So I will show you some of our cases. This lady has been treated just once with a combination of the PR, Nordlus, and the PicoWay Resolve, and we saw her 12 months later. So this is just one treatment, and the 1064 Resolve has a great effect and impact if people are looking for long-term results. Yes, so this takes time. As we know, collagen stimulation is not happening during a day, but it's if you do that regularly, you can really achieve great effects. So this is a patient, which we treated within 12 months with different modalities. So she had 3 Pico treatments done. She had a collagen stimulation with calcium hydroxyapatite. She had a bit of hyaluronic acid, regular neuromodulator treatment on platysma and around the eyes. And you see the rejuvenation effect of it. That's another lady who was 66 when we started. She's 69 now. And this is the progress she made in 36 months. So with our multi-layer modalities. So she had 6 Pico 1064 Resolve treatments. She had 2 IPL treatments, some fillers, some collagen stimulators, and a bit of Botox. She's not a big fan of neuromodulators. But you see how the skin changes, how the collagen gets stimulated, and how she just looks naturally but still younger than actually before. And this is a girl with acne. Sometimes not easy to convince our acne patients to get photographs of them and to show the photographs because they feel so embarrassed. But she allowed it to me finally. And she was treated not with the Pico, but with the combination of PR and 1940. And also one treatment of 1550. So you can see that also achieves a really good result on the inflammation, but also on the texture of the skin. We gave her some isotretinoin in a really low dose just for 2 months, and had this really nice result on her. Yeah, that's her again. So in summary, the 1064 Resolve allows us really to efficiently and treat all skin types. It's a well-tolerated treatment. We have really excellent results in improving texture of the skin and atrophic acne scars. We have no thermal damage, and it's a really ideal component in the multimodal layered approach. Thank you very much for listening.
Okay. Hello, everybody. Greetings from Serbia. Thanks to Dr. Cordula and Dr. Wu for amazing presentations. And now I will continue on my cases and to show what I can achieve, or what we can achieve with Pico. The objective today is the deconstructed science behind picosecond lasers with the interactions with tattooing, melanin, and scar tissue, as well to know what sets our PicoWay, well, Candela PicoWay device apart from other picosecond lasers, which Dr. Douglas Wu really did a great job. And also how to explore combination therapies, like also Dr. Cordula showed, with biostimulation, polynucleotides, polylactic acid, calcium hydroxyapatite, and exosomes. And also this will benefit both experienced and non-experienced laser doctors, enthusiast doctors, and it will sharpen their precision, improve safety, and elevate patient satisfaction. So when we speak about the tattoo ink is usually consisting of metallic salts and carbon-based particles that are bended in dermis at a depth of 1.5 to 2.5 millimeters. Particle size are usually from 20 to 300 nanometers, which affects also how easily they are shattered by our lasers. And the clearance is mediated by immune response, which is usually done by macrophages and lymphatics. When it comes to pigment, it can be epidermal, it usually means superficial melanin, like lentiges, and dermal deeper pigmentation, like nevosota, or post-inflammatory hyperpigmentation, or it can be mixed. When it comes to ink, we have to consider color, particle size, and depth, and adjust our laser parameters accordingly. Dr. Dallas already said this is the shortest pico pulse duration on the market, with the peak over 300 megawatts. And the wavelengths, once more, just shortly, 532, 785, or 730, and 1064, with also resolved hand pieces, which induce lyopes for collagen stimulation, and it has CE marked. Okay, when it comes to effect, as my colleagues already said, photoacoustic means transforming the light energy to the mechanical ones and shattering the pigment, while the older generation lasers have photothermal energy with heating up the surrounding tissue, and that in clinical terms means faster clearance, fewer sessions, and safer for darker skin types, as well as less side effects, which means less surrounding tissue injury, and that equals all less downtime. And also the higher peak power, this 300 megawatts, means that the smaller particles can be targeted easier than with the other brands. So all the colors have their own corresponding wavelengths, which black and dark blue or darker colors can be treated with 1064, red, orange, yellow with 532, green, blue with 730, and yellow, white is very hard to treat. So the guidelines which I usually use is 1064 is, here it says 2, but it's from 1 to 6 joules. 532 is usually I use from 0.8 to 2.5, and 730 is usually I'm doing from 1.2 to 2.8. Both sizes is from 2 millimeters to 5 when it comes to ink, and 7 millimeters when it comes to pigmentation. So we have frosting as a clinical endpoint, which Dr. Douglas explained great, really, I'm amazed. But also we have darkening for deeper pigmentation. So it's not always just a whitening, we can also have darkening as an endpoint for our pigment, but for ink, it's always frosting. And as Dr. Cordula said, we can do adjuvant procedures with cryocooling or sometimes topical anesthetic for tattoos. For how do we explain our patient how to use, what to expect, how many sessions, we have something that is called kit with the size scale, and it usually have these parameters like skin type, skin color, complexity, density, layering, tattoo location, and scar presence, and it has the total score range from 5 to 21. So we have less than 7 is usually 3 to 5 sessions, from 8 to 14 is 6 to 10 sessions, and from 15 and so on is 11 plus sessions. But this is only as a guidelines, so it's not a rule. It's very important to explain to patients everything is a variant, especially here, because as this, while I'm using Pico for like 6-7 years, I have seen a lot of different responses which are expected and not expected when it comes to the speed of removing the tattoo. So when it comes to tattoo characteristic, in my experience, it's amount of pigment, how many times of the sessions has been done, has been applied, the colors has been used, because sometimes this frosting that you achieve as an endpoint with the ink can block you for doing the other wavelength for the other color that is intertwined with this color that you already treat. So you either have to cool it off for like 45 minutes to 1 hour, or to move it to the next session to treat the lighter colors with different wavelengths. And also the scarring is a big issue because nowadays we have all these different unknown lasers by unknown manufacturers that usually make these photothermal damages, which are awful. and then may cause scarring. And scarring is the thing which block our PicoWay to reach these particles. So we have to treat the scalp with some ablative laser as well. So for me, also, what impacts the clearance speed is the age of the tattoo, the location on the body, and also skin type and color, as well as metabolic activity and health of the patients. And also, which is the most important in the speed, is the skill and the experience of tattoo artist. The more experienced tattoo artist, the faster we can remove the tattoo. Before it was vice versa, but now when the tattoo artists are doing this nice shading and nice contouring the lines, they do it very shallow, and that gives very nice clear lines, and which we can use our PicoWay laser to really remove it fast, and as I will show you later on my clinical cases. What I also use in my practice, not only for removing the pigmentation, but also to help me with tattoos, is hydroquinone, niacinamide, and tranexamic acid, which I combine in the breaks between treatments with the tattoos, because hydroquinone, which inhibits tyrosinase, is also helping me reduce melanin synthesis and gives me greater contrast between the ink and the skin. As well, the niacinamide promotes the reduced inflammation and strengthens the barrier and faster skin recovery, as well as tranexamic acid that protects us from further post-inflammatory hyperpigmentation. SPF is mandatory every single day, and all the isotretinoins or other acids need to be 5 to 7 days excluded from the treatment area. We can also reconsider corticosteroids, low potency, either systematic or intralesional or topical, because if we have keloid-prone areas, we need to think about that as well. And also minimizes the post-inflammatory hyperpigmentation and epidermal competition for the energy, which again making the bigger contrast between the ink and the skin. With hyperpigmentation, we have 5T2 for superficial pigment, which gives us frosting, and 1064 for deeper pigment, which gives us darkening. The split beam handpiece I usually use in this case for this extra glow, blending effect, and also collagen boosting effect. And also I use all my topicals here. With acne scars, Dr. Cordula said we have rolling boxcar ice fix, and the best is a boxcar for PicoWay Resolve handpiece with split beam. And we stimulate the collagen as well. We can combine with polylactic acid with exosomes, and I usually do 3 to 4 sessions every 4 weeks and do all of these treatments at the same time. So the combination is always the key with everything in medicine. We have to utilize all our available resources and make a tailored approach for every patient. And all medicine, as well, especially aesthetic medicine, gives the best outcomes with integration of different combination of techniques and technologies. And this is an excellent way to enhance patient treatment and practice and effectively apply all your knowledge. And as well, why we do this is because we can. And with the multiple technologies at our disposal, we should embrace our creativity. How the thought process function is we need to conduct the clinical examination. We need to consider the budget of our patient and prioritize if it's limited. And we need to develop a solid plan to give a calendar to our patient and schedule appointment and also to avoid all definitive statements. This will be like 4 treatments for sure. We have to avoid that because we need to set the proper expectations and therefore realistic outcomes when it comes to the patient. With all of these procedures that requires time, it's not instant effect, but in time it gives the best effect. Okay, so now for clinical cases, first we're going to start with tattoo removal. So here I'm going to show you this video, full sleeve tattoo, which was only 3 treatments with complete removal. So I'm still waiting for a video. Okay, now you can see all of the full sleeve tattoo, which is really busy, very busy tattoo, 360. And you can see how it looks like only after 3 treatments. You make a break between treatments 6 to 8 weeks. I usually make a break 6 to 8 weeks, but it can be from 8 to 12 weeks, even longer, to let our bodies and our immune cells really remove that pigment. Here we can see an example how it looks like also 4 treatments, 6 to 8 weeks apart. Here as well. So these are the newer, let's say, tattoos with better technique. So it's very easy to remove it completely without a trace. As well as this, all this shadowing tattoos usually gives us great results and very fast results. Because when the tattoo becomes mushy, that means our body already started eating away the pigment. So that gives much faster results when we treat it with PicoWay. Here as well, somewhat deeper, thicker lines, but also complete removal. This halo that you see, like a ghost of a tattoo, to say it like this, disappears as well in time. But usually patients that are then away, too far away, so you cannot really catch up with them. But all of this disappears completely. Here we can see these promises that are not promises anymore, and some other tattoos, neck tattoos. So this is the biggest joke here in our tattoo removal story, because permanent makeup can really be a Pandora box. It can go from black to red, from red to green to yellow, and so on, pink, even neon. So but whenever I was at the discussion at the IMCAS or MWC, when they combined all of it, it was usually the PicoWay was the most effective one when combined to other Pico lasers. And this is what I've been saying about tattoo removal and the experience of the tattoo artist. The same tattoo artist, but different years of experience. So the tattoo that is when he had more experience went away faster than this letter A that you see now. So it's the same tattoo artist, just different years of experience. Here we can see a victim of abuse where I had to combine some ablative lasers as well to remove these eyes. But when you start doing this for a longer time, you really see a lot of strange things. This is one of the top strange things I've seen. Again, all this shading is faster, and the sharper lines, deeper, are a bit slower when it comes to the clearance. Here is very important why this was 6 weeks, because this guy had scars over this tattoo, and then I had to do ablative lasers as well in the combinations with Pico to achieve this result. Here we have also a full sleeve, which I should have made video now I see, but also you can see from the pictures. And now this is very important. We have something when it comes to allergy on the color. So allergies on color usually is the red ones. This is how tattoo looks like with this keloid formation because of the allergy of the red color from the tattoo ink. And when we do pre-medication with corticosteroids and antihistaminic and use ablation with Pico, we can achieve this result. Now this cherry looks even better. Here how it looks now, and still the treatments are continuing. And now we have some videos to show how it looks like when we treat. Sorry. Yeah, okay. Okay, so here you can see basically this whitening and how it looks like. It's super fast and easy. You have a steamer to cool off for a pain reduction, but basically some letter tattoos, it's really like 15 seconds to treat them, and it's very comfortable. As Dr. Douglas said, now I have also the new arm for this Pico, and it's amazing. So for people who already have Picos, it's really a game changer, this arm. Also here you can see maybe better. I'm sorry, it's a bit slower, these videos, but hopefully it will play now. Okay, so with the two removals, you can here see this whitening, how fast it is with permanent makeup, and it's really easy and comfortable. All of these patients have topical anesthetic with some cooling, and it's not so pleasant, but it's very fast. And also what helps us with this frosting, we cannot over-treat the area because this frosting stops the laser, and also the skin that doesn't have a pigmentation or ring doesn't react on this laser when you treat. So here now we can see the post-inflammatory hyperpigmentation because this patient removed some cysts and changes in the skin like warts with plasma pen. I here used Pico toning with Pico split beam and then fractionate dye laser, and then we'll combine it with succinic acid and microneedling to achieve this effect. Here, this is only one treatment, and in combination of these three different technologies and these amazing results. Here, what we need to pay attention if we have ablation lasers that's underlying rosacea that can cause problems like this, post-inflammatory hyperpigmentation, as well as redness. So this combination, when you combine Pico lasers and then IPL from Nordlis and Frax from Nordlis, with combination with microneedling and exosomes, we get results like this. And it's really very happy patients. So not only that you remove these complications, you also achieve amazing collagen boost results. This is just photo aging, which was treated with Pico lasers, again, Nordlis and microneedling, and very good results with almost no downtime, especially when you combine with exosomes. Here as well, this was the Pico laser, but as well as collagen booster, and we achieved the reduction of photoaging as well as great anti-aging effect. So pigmentations are removed as well as the collagen boost, which we achieve is layered approach. As Dr. Douglas said, first I usually treat the localized interlesion with Pico, and then I do the Pico toning and resolve the entire face, and then I continue with injectables and exosomes. Here as well, happy pigmentation with skin rejuvenation in combination with topicals and exosomes. And why I like Pico toning, because when you use Pico toning, which means using the Pico Zoom 1064 handpiece with lower fluence, like 0.8 to 1.0, with high frequency, you are very gentle to the tissue, and you achieve removal of the pigmentation that is usually diffuse with really no traumatization of the surrounding tissue. And this is a very nice video of how you can combine different technologies and methods. So here I did Pico, split beam, and then polynucleotides with polylactic acid, and exosomes with PRP. So let me show you how it looks like. Still waiting for the video. So, because acne scars is a complicated state of the skin, we have to layer our approach and sequence therapies. And acne scars repairs is not just a treatment, it's a dialogue between the laser and the cell. And hopefully I will be able to show you that with my next video. So first we start with Pico Resolve 1064, several passes when we get this erythema. diffused and almost no pinpoint bleeding, then I continue with collagen boost, which I use blunt cannula, as well as while I'm doing that, I do some sub incision of the areas I want to make more superficial when it comes to scarring. And then I continue afterwards with combining exosomes and PRP. That's what I decided to is the best way to use the exosomes in combination, because then you get this creamy texture, and really this is the multi-layered approach. So video didn't finish, but in the end I did use the microneedling device for this exosome and PRP. And this is also a tattoo that was permanent makeup, but for stria at the skin, and then it was kind of brownish, but then it make an oxidation to this gray color, and then gives us a little bit of trouble, but in the end we removed it entirely. But this is just to show how many variations of tattoos we have now in our time. Okay, so the key takeaways here is that we need a thorough clinical assessment and well-structured treatment plan to have biggest effects. We have to maximize resources that are available to you, both clinical and tools and support of the systems. We need to be flexible to evaluate our outcomes and be ready to adjust our approach accordingly, and to treat the patient as a whole, not just presenting the concern. And this is my content, and thank you so much for your attention.
Wow, phenomenal lectures, Dr. Lukic and Dr. Ahnhudt-Franke. All right, well, that was amazing. We have a ton of questions, so let's just kind of jump right into it. We have questions about settings. So let's maybe answer these parameter questions first. And we'll kind of go around to each speaker so they can give their opinion. But in terms of, for my end, settings, it really depends on what you're treating, and critically what endpoint you're looking for and what endpoint you're achieving. So in general, for pigmented lesions, I will choose a spot size that tries to match the size of the lesion. So anywhere between usually 2 to 4, maybe 5 millimeter in spot size. And then I'll adjust the fluence if I'm using a full beam, so that I can achieve selective endpoint. Okay, and that can be a wide range, and it depends on the wavelength that I'm using. At 532 nanometer, for example, at 2 millimeter spot size, it's going to be between 1 to 1.25 joules at the very, very low end. At 4 millimeter spot size, it could be between 0.3 to 0.7 joules, maybe even 0.8, depending on skin type and depending on lesion pigment density. With the 730 or the 785 nanometer handpieces, then usually it's going to be a smaller spot size and a higher fluence to achieve the correct endpoint. At 1064 nanometers for discrete pigmentation, I try not to use that necessarily for most cases of discrete pigment, because the other wavelengths I think are a little bit more effective. But again, it depends on the endpoint that you're achieving. So that's how you adjust in terms of the fluence level. And then your rep rate is whatever you're comfortable with. I usually use between 3 to 5 if I'm treating pigmented lesions. But for tattoos, maybe Dr. Lukic, you can give your input on that, and then followed by Dr. Ahnhudt-Franke.
Yeah, sure. I would suggest for the easiest answer is to use for tattoos the biggest spot size and the smallest fluence to achieve your endpoint. That is the best answer for tattoos. And how the sessions last, you increase the fluence and decrease a bit spot size, and then you can get. Sometimes it can even happen that you can combine even resolve to blend in the pigment, but as well as whenever you, even if it's the same as the last time, if you achieve the frosting, you can easily just continue with the same fluence. So that would be my advice. So biggest spot size with smallest fluence or lowest fluence you can set to achieve the endpoint.
Yeah, in tattoos we usually start with the biggest spot size, and start with a low fluence, and then we move it move it up. Bon, how is your experience with the combination of Resolve, 1064 Resolve and the Zoom in tattoos?
It's very good because sometimes you have some hue of the pigment or this light kind of mushy remains of the pigment. And basically the Resolve just kind of smoothens it all in. And what I noticed is after that treatment, usually I need lower fluids for the next time after I use Resolve. And I also think that using a Resolve after Zoom increases the circulation and this inflammatory response, and so the pigment removal gets faster, in my experience, of course.
Yeah, we also tend to combine it. Yeah, so definitely it has a good impact on the skin texture, right? On improvement of the skin texture.
Yeah, very good. Very good, and also with the topicals, especially when people are tan. With the hydroquinone and tranexamic acid, I would really advise that to try. It's very good.
Our next question is about tattoo removal, and in terms of permanent makeups or cover-ups, what is our strategy when the permanent makeup, for example, becomes paradoxically dark? And how do we go about treating that? And in general, what are our approaches for treating cover-ups? Maybe we'll start with you, Dr. Lukic.
Sorry, thank you, David. For now, usually I had that with white color and with pink color, especially on the lips. And when you have this going to gray paradoxical darkening of the pink color, especially on the lips, it gives very, very complicated results for a patient because they look unhealthy with the gray lips. But luckily, Pico really resolved it with combination with Resolve and Zoom, but it takes time. For this, it's usually then 6 treatment. And the permanent makeup, I treat every month. I don't wait 6 to 8 weeks. And for the cover-up, it's all good while it's darkly colored black, which usually cover-ups are. And that just means more session, because as I said, more ink equals more session. And sometimes you can also combine it with these ablative lasers that are fractionated for faster results. So really, I had a very nice experience with all of the above. But permanent makeup is really something that is most complicated out of all the tattoos we have on our bodies.
Yes, for paradoxical darkening, it's a challenge, obviously, and you can never really predict when or how it'll happen. But we did publish many years ago using a Q-Alex, and it took like 20 plus treatments or something like that to remove. But what I found with PicoWay 1064, if your tattoo ink darkens paradoxically, then you just switch to the 1064 nanometer wavelength.
No, that's
straight through. Yeah, and it'll disappear in a reasonable amount of time. Again, you just respect typical treatment parameters and endpoint adjustments. And I find that the paradoxical darkening resolves quite nicely, actually.
Oh yeah, it just means instead of 3 treatments, 6 usually for me. And for me, it was just pink and white color that we should be very off. The other colors, I never had any kind of paradoxical darkening.
Yeah, we have a question about yellow ink. Any tips on yellow ink, maybe for like eyebrows or just anywhere really? Yellow ink.
532 peak with Zoom really removes it very nicely without any issues. And also, maybe they also meant when you can do a cover up after you remove tattoo. Maybe that also. You can do basically next tattoo to cover this mode if you don't want to remove it at all after 2 or 3 weeks.
Yeah, I would agree with that. 532, again, getting the endpoint is critical. And this was published by Roy Geronimo's group, I think, in maybe DermSurge or JAD, I forget what. But for yellow ink, the 532 works quite well in my experience. Dr. Ahnhudt-Franke, do you have anything to add to that one?
I mean, Yeah, we have a couple of patients with yellow ink, and they do. They react really well to it, but then the response is not really that great, I find. So they still come back with the yellow tattoo. So it takes really lots of sessions, you know. So it's quite stubborn, the yellow one. So
yeah, it can
I don't
be.
know. Yeah.
I usually like to extend the treatment interval. I wait longer in between treatments, and I find that helps to resolve it, just as well as treating more times. Sometimes I find that just the patients are waiting.
How long do you wait? How long would you wait?
I usually wait 3 months in between sessions if the ink is stubborn.
Okay, so we usually wait 8 weeks, up to 10 weeks, but
Yeah.
Maybe it's a good idea to extend that even. Yeah.
Yeah, I've had odd cases where I do one treatment and they come back 2 years later and it's completely gone. It's like the darkest tattoo ever, and they've had no treatments in between, and it just keeps on fading and fading and fading. So sometimes in stubborn cases, I just wait and it tends to go away. But combining, like Dr. Lukic said, fractional CO2 and the split beam resolve handpiece can be quite useful as well. We have a lot of questions here. Hair loss around eyebrows, when removing eyebrow tattoos. Any problems with that?
It doesn't happen. You can only get this whitening of hair, but it's reversible and it's not permanent. And you can put like some pen or Kana right after 2 days without any issues on that hair.
I would agree. Yeah. And you can treat with confidence because the PicoWay, as we've mentioned, it's mostly non-photothermal. In order to get semi-permanent or permanent hair removal, you have to thermally ablate the hair follicle, which is why only long pulse laser can remove hair. You will get whitening of your hair, and it'll get brittle and it'll crack, and it'll drop out a little bit faster, but it will not be permanently removed. So you can treat with confidence in those situations with the PicoWay. Not necessarily though with other longer pulse lasers, like nanosecond lasers may have enough heat effect over time. Cause a little bit of micro scarring in the area, so do be cautious about that. Let's see, we have a question for Dr. Ahnhudt-Franke about how you use, you keep the Resolve handpiece in contact with the skin whenever you treat.
Yes. Always, yeah. I think that's very important to keep the contact because you don't want any epidermal effect. So you really want to deliver the energy right into the dermis. So that's why it's super important to keep the contact at all time. You don't have to put pressure, but you have to be in contact.
I would agree with that. And a general question for the audience, for the speaker panel: how would you combine IPL and Pico? Both Dr. Lukic and Dr. Ahnhudt-Franke kind of mentioned that. So maybe you guys can explain how you guys like to do that.
I use that combination a lot. So I use a lot. So first, I usually start with the IPL, for instance, in acne. So we first laser we first treat the vascular chromophore, or then we go into the deep layer. So that works really, really well, and in one session even, so one after the other.
Excellent. Dr. Lukic? Oh, well, I'll fill in. I agree. I feel like the order depends on what you're trying to treat. If you're treating vascular component first, then you would use the IPL first because that allows you to see the endpoint more clearly. If you're treating discrete pigment first, then you may want to use the Pico spot to treat discrete pigment followed by the IPL. So there's multiple ways that I feel it can be done. It's very versatile. Both technologies are very versatile and can be combined in many ways. Do you guys use those patches? There's a question about have you heard of the perfluorodecolin patches that can be used to immediately clear the frosting with tattoo, so you can do multi-pass tattoo removal? Any experience with those specialty patches? No. Yeah, this was a method published many years ago by Rox Anderson and colleagues called the R20 method, where he would do 4 passes, but wait 20 minutes in between passes so that the frosting would clear and therefore the laser could be applied again. But some company created a patch that was embedded with perfluorodecalin that immediately clears that frosting, so you don't have to wait, and you can do multi-pass tattoo removal. I've used it many times, and you can, I guess if you're handy with a chemist, you can probably find this chemical and use it just to clear the frosting yourself. I don't really find it makes a big difference, in my opinion, for tattoo removal, especially with the PicoWay. With the 1064, you can actually continue to treat multi-pass almost without need to wait for the clearance of that frosting. So I don't find that to be particularly useful in my own practice. Here's an interesting question about tattoos. When they get very light, and do you still chase the frosting endpoint, or is there something else that you can do when they become very light at the end?
I always get the frosting in the end, but for that is the resolve really takes pigment after that.
I would agree with that. I think that's a very good tip, because at the very end of a tattoo, when it's very light and sort of smudgy looking, it may not even be ink that is left over. It might be endogenous pigment that is contributing, and to combine the resolve handpiece at that point is brilliant. It works very well, doesn't add any downtime, it's even less painful. But yeah, in general, if there's ink remaining, then you can almost always achieve whitening at some setting. You just have to adjust the settings with the PicoWay. If there's ink remaining.
I would like to add there, sometimes we don't see the pigment, but we have a huge response, like invisible kind of pigmentation around the tattoo, out of the borders of the visible tattoo. But I treat all of it if I see. I'm so sorry, my cat is very playful all of a sudden.
Yeah, totally agree with that. The laser is actually is more selective than our eyes. And so if the laser is giving you an endpoint, then there's definitely ink there, even though you may not necessarily see it. And then one last question, maybe because for time purposes, but Dr. Ahnhudt-Franke, there was a question about combining Pico with topicals, polynucleotides, things of that nature. Maybe you can explain sort of your approach to that.
So we usually do the Pico Resolve 1064 Resolve handpiece every 4 weeks, in 3 sessions, and we combine even in the same session polynucleotides. We combine the neuromodulators, but we always start with the laser and then inject. So it's always the same order. Yeah. So start with laser and then you can inject.
I would agree with that. Dr. Lukic, anything to add there?
I completely agree with Dr. Cordula. Before, for this like CO2 lasers and stuff, sometimes it's better to inject because of the lidocaine product, so it makes CO2 easier. But for Pico, I completely agree with Dr. Cordula. First laser and then do the injectable, especially since it's really laser is almost painless, and then it's very easy to inject afterwards. And somehow they feel less of the pain even with the needles after the result, like they do with the tattoos.
Mm-hmm. Yeah, very good tip. Yeah. All right, well, we have actually many, many more questions. The engagement from the audience has been brilliant, but we are unfortunately out of time. And so I think maybe if outstanding questions can be collected by Aviva, and we can sort of address them sort of offline. But it was a real pleasure to join the group this evening, and I think we can kind of wrap up here. On behalf of Candela, I would like to thank you for your participation in the virtual meeting. Once the meeting ends, the post-event survey will appear requesting your feedback. So please take a moment to complete the survey, as it will help plan future virtual meetings. And this concludes tonight's program. I hope you all have a great night.
Thank you so much. Likewise.
Thank you so much.
Thank you.
Yes.
Okay.
It was a pleasure.
Thank you.
Thank you.
Bye-bye.
Bye.
Bye.